my name is Dr. Emily Splichal, functional podiatrist and human movement specialist. A condition that I often get presented with in my office is lateral foot pain. Now, lateral foot pain is often associated with prolonged standing, running, high arches, and those who may have a history of ankle instability. Now, one of the most common conditions or diagnosis for lateral foot pain is going to be perineal tendonitis. So if we take a look at this picture here, I want you to appreciate that on the side of your foot, there is a bone called your fifth metatarsal. And that's right here by your fifth digit. If you go all the way back to the middle of your foot on the outside, you're going to feel a bump. And that bump is the base of your fifth metatarsal. Now what attaches there is a muscle tendon called the Peroneus Brevis. Now this muscle wraps behind your ankle and is used to stabilize the outside of your ankle when you stand, go into a push-off position, or when you're doing different directions and cuts. So you'll actually see this a lot in athletes. So now your perineals, your Peroneus Brevis, as it inserts, if it starts to get pulled on a little bit too much, you can start to micro tear the tendon, creating a tendonitis. Now, if you are experiencing lateral foot pain and it's specific to your Peroneus Brevis and your perineal tendons, what I suggest doing is take the stress off of the tendon. Start by doing myofascial release to the tendon and muscle. It is a great release technique to get to the bottom of the foot. So I recommend a 5-minute foot release to the bottom of the foot, followed by 5 minutes of myofascial work to your perineals, so they run along the outside of your lower leg. Your perineals actually continue all the way up through your IT band into your hip. So if you're experiencing lateral foot pain, not only do I want you releasing the bottom of the foot and the side of your lower leg at your perineals, but I want you to go all the way up into your hip and release your glutes and the front of the hip, which is called your TFL. Now, if you are still experiencing lateral foot pain despite incorporating foot and hip release techniques, then I recommend seeing a podiatrist or getting a consultation. If you're interested in learning more about lateral foot pain or to see me for a consultation, please visit dremelysplichal.com.